Hi, I am Pamela Palomar and I am going to discuss my topic, which is typical and atypical development. So first, let us unlock the term typical, atypical, and development. So what is typical? When we say typical, it is a person or thing that has the same characteristics of everyone or everything else in the group. It is conforming to a particular type, meaning it is something that is common or normal. And on the other hand, atypical is a person or thing that is unusual. It is not conforming to the type or something that is peculiar, not common, or not does not follow a usual pattern. So these two words, which is typical and atypical, are very different or opposite to each other. So next is, so what is development? When we say development, it is something or it is a situation and sequential changes that occur with the passage of time as an organism grows. It is an event constituting a new stage in a changing situation. It is having a progress or something that gets improved. So when we say typical development, it is It is all about the normal progression, developing the skills orderly within a certain age. For example, crawling, standing, walking, and running. So that um, actions are in is under typical development. So that is an example. Next is for the preschool age. Um, for their physical, height and weight gain consistent, meaning their weight, their height, their height or weight, like um, their weight could be heavier, and they will going to be taller in, like they could be more taller or heavier consistently. Then cannot sit still for long periods of time. So um uh, child with at this age cannot cannot tend to sit for a very long time. They tend to move around or roam around because it. Okay, so let's go to the preschool age. In under their physical typical development, their height and weight gain consistent, and they cannot sit still for a very or for a long periods of time because they prefer walking or roaming around. They begin to lose protruding stomach. So that's for their physical. When it comes to social, um, preschool must learn social rules of sharing and taking turns before they will able to cooperate with others. So it means reciprocity. They have this reciprocity. Then begin to understand, explore, imitate, and practice social rules. Play often reflects experimentations of social rules. So these the children with preschool age does um normally. Next, they learn the concept of right and wrong and understands the nature of rules. Experience guilt when they've done something wrong. So at this age, child or children already knows to feel guilt or feel something wrong when they have done something that is bad or that something is wrong. So that is for social. Let's move on to the cognitive. When we say cognitive, so for cognitive, um, they are receptive and expressive language develops rapidly grammar and syntax refined, vocabulary increases rapidly. So in this time, limited understanding of cause and effect in sequencing events. So meaning um, it's limited. And then their thinking is egocentric. When we say egocentric, it is being self-centered. So next is have vivid imaginations, engage in magical thinking and fantasy. Difficulty distinguishing between fantasy and reality. So have you ever experienced, or do you have a nephew, sisters, or little child or children in your home? Um, have you ever told have you ever told her or him about stories which is fairy tale or something about magics or fantasies? They are like um comparing it to the real life. Like they will say, what if I will why does I don't have a um wings, just like what I have seen in the movie or in the videos, something like that. So next is their emotional beginning of impulse control and ability to delay gratification, and self-directed and self-starters, very curious and willing to try new things. Their self-esteem is largely dependent upon other people's reaction to them. So in their emotional, they are already self-directed and self-starters. So when we say this, they are curious of um, why are these things like this? Why are these things like that? Something like unending questions, just like that. And next is infant and toddler. So for infant and toddler, their physical typical development or their development is birth to 1 year of age, the development of control and mastery of gross and fine motor skills. So in 1 to 2 years of age, perfected skills, balance, coordination, stability, ability to manipulate objects. So from 2 to 3 years of age, increase in motor skills, master challenges in the environment such as bicycles, stairs, balls, eating utensils, crayons, etc. So by the end of this year, ready to master toilet training. Okay, so next is cognitive. When we say cognitive development on this age, birth to 1 year of age, they develop alertness, recognition, and interest in visual, auditory, and tactile stimuli. So they develop object permanence toward end of year. So for 1 to 2 years of age, ability to understand and produce language, acquire understanding skills before spoken skills. So for 2 to 3 years of age, language is used to communicate with others. So language skills is perfected at this age. So that is for cognitive. So when we are talking about social, from birth to 1 year of age, most important task is development of attachment to primary caretaker. Stranger anxiety develops at about 6 months of age. So, have you ever observed when you have met your friends having a 6 months old baby or 7 months old? Like they tend not to um they tend to cry when you are going to when you try to carry them. So they already have the stranger anxiety. So, from 1 to 2 years of age, affectionate and trusting relationships with other family members and adults outside the family. So, engage in simple games and play. So, for 2 to 3 years of age, begin to imitate social roles, playing in the presence of other children but not interacting with them. It is like parallel play. So when we say parallel play, it is a form of play in which children play adjacent to each other but do not try to influence one another's behavior. Okay, so toilet training represents a significant internalization of social roles. So these are all under social development of a infant and toddler. So next is their emotional development. From birth to 1 year of age, task is to develop trust through positive attachment with primary caretakers. From 1 to 2 years of age, primary task involves the beginning development of autonomy, understanding that they exist as a separate entity from the caretaker. Begins exploring but often checks back with caregiver. So, um, from 2 to 3 years of age, autonomy is solidified. Experience pride and pleasure at being good and embarrassment, shame, and distress at being bad. So that's for emotional development. Next, so we're done in typical development. So at this moment, we're going to discuss or to move on to atypical development. When we say atypical development, it occurs when a person develops an unusual pattern of behavior, emotion, or thought. It occurs when a child appears lag behind or is way ahead of same age peers in any of different skills. So a child is unable to perform like typically developing peers, but the potential for growth is still present. So when we say atypical development, it refers to the different development which are being behind by other peers or of the same age. Okay, so for example, at the age of 3 years old, a child cannot still talk. So their development is uh, lag behind. On the other case, a 5-year-old doesn't show any interest on many things. So that is still part of a typical development. So how can we assess or assessing a typical behavior? How can we know that a child is has an atypical behavior? So observation on a child's development and learning should be shared with parents to develop a comprehensive view and to provide ongoing support for progress or intervention. So in assessing atypical behavior, recognizing atypical behavior includes the following steps. So first, identify skill levels that indicate a child's development is atypical or either advanced or delayed in comparison to the average child of the same age. And next is assess whether patterns of behavior are reflections of a child's personality, are culturally influenced, or if they indicate an area of concern. Next is record the age at which skills emerge, sequence of skills and quality of skill level, as well as how they contribute to a child's ability to function. Make a note of dates and times of occurrences to identify patterns, duration, and frequency of behavior, types of activities, setting interactions with peers or other influences. And next, share collected information and concerns with parents and ask them to contribute any observations or insights they maybe have about their behavior. So next is adapt the learning program or environment to support the child's strengths and weaknesses while providing external resources or ideas that may help parents. So, how can we know if a child um, has are experiencing an atypical development, or what are the signs? So these are the answers. Some sign of an atypical development is the absence of reciprocity. When we say reciprocity, it is a process of exchanging things with other to gain mutual benefits. So that is the one which um, absence for a child has who has been experiencing atypical development. So next is lack of sharing enjoyment or interest. Next, problems with joint attention and apparent disinterest in parents or other children are also concerning atypical characteristics of social development. So other examples include intense separation, anxiety, unusual fearfulness of people, and extreme shyness. So why do you think these developments important? So, so the importance of studying this type of development is are first, benefit 1. Knowledge of child development and learning provides the best foundation for planning for a group of children. For benefit number 2, knowledge of child development and learning provides the best starting point for planning for a new child. Knowledge of child development and learning helps to plan next steps for supporting children's progress. Is the benefit 4. Knowledge of child development and learning enables providers to create curriculum and environment that aligns to state standards or guidelines for early childhood programs. So, next is knowledge of child development and learning helps providers feel confident that their professional practice has a solid basis that aligns with larger child care community.